All right, guys. So in this lecture, we're going to take a little bit of a look at essentially the anatomy of the heart, external and internal. We're also going to take a little bit of a look at specifically the valves that make up the divisions of the heart chambers, as well as the valves that control blood leaving the heart. And we're also going to take a little bit of a look at the basic pathway of blood through the heart. Like I said on Friday, this is going to be an it's going to be covered in an assessment that we'll take on Thursday. I've posted quite a few different things to kind of give you guys a little bit of some review material. Hopefully that's enough. If it's not, somebody please let me know and I'll try to get some more stuff up. But let's go ahead and try to get through this just a little bit. Okay. All right. So we saw this the other day. This is just the basic kind of makeup of the heart, looking at an external view. So I'll just kind of work my way down the right hand side and then down the left hand side. And I'm going to cross out a couple things because I don't think we need them. So I'm actually going to take out the brachiocephalic artery. It's not something that we really need to know kind of at this point. We'll talk a little bit more about it when we get to kind of blood vessels and arteries itself. But one of the big things we do need to know is the superior vena cava. That's the large vessel going into the right top portion of the heart over here on the other side, and its counterpart is the inferior vena cava, which is down here at the bottom, which is the large blue vessel going into the bottom. All right. Next one that we need is the right pulmonary artery. That's this little vessel leaving the right side of the heart here. It's our left side looking at it, but the right side of the patient's heart. This would be going over to the right lung. All right. That actually, if we trace it back, comes out of the right ventricle. So it comes up through the pulmonary trunk and then actually goes out to the lung through the pulmonary artery. All right. We do need a little bit of the ascending aorta. So we need to know that that is this little arch right here. That's actually coming out of the lower part on the left side, the left ventricle. All right. So the blood actually comes up through here, passes behind this chamber. All right, and then out through the aorta. Pulmonary trunk is another one that we do. So this is the common trunk coming out of the right ventricle, all right, leading to both the right and left pulmonary arteries. Okay. The next thing that we need down here then is the right pulmonary vein. So this is how the blood gets from the lungs back to the heart. They actually pass behind the backside of the heart here and dump blood back into the left atrium. All right, and then their counterpart is over here, the left pulmonary veins. Right atrium is another one that we need. So this is the chamber up to the top part of the heart here. All right. Coronary arteries, you really don't need to know that they're the right or left. I think you just need to remember this portion. So you just need to know that they are coronary arteries. They kind of fall across the surface of the heart here. Again, I'm going to take this one out. We don't really need the anterior cardiac vein. Right ventricle is the next thing that we need. So this is the chamber at the bottom of the right side of the heart. All right, it's the smaller of the two ventricles. All right, obviously the left ventricle is bigger, right ventricle is much smaller. Again, we don't need this marginal artery. I think we can take that one out. We can take the small cardiac vein out as well. And then the last thing you really need on that side is the inferior vena cava. So anything I left out or either circled are things that are fair game for the assessment. Okay. Over on the left side, then we can take out the left common carotid. All right, we can take that one out. We could also take out the subclavian. We're going to leave in the aortic arch because that's the portion up here at the top. We can take out this ligamentum arteriosum. All right, that's not really that important for us right now. Left pulmonary artery. So again, this would be headed towards the left lung over here. All right, we need that one. And the left pulmonary vein, those are the two vessels right here that would be leading into the left atrium coming back from the lungs. Next one we need is the left atrium itself. So that's this little flap up here at the top. We can take out this auricle. We don't really need to know that. All right, the auricles essentially are just the expandable portions of the atriums. They look sort of like little ears on the sides of the heart. I'm going to take out the circumflexion artery. We don't really need to know that specifically. And then we can take out the coronary side over here as well. We just need to know specifically that those are coronary arteries. Okay. Next thing we need then is obviously the lower chamber, which is the left ventricle. All right. The great cardiac vein, we can kind of take that one out. I will say one thing is kind of important to know is that you can tell the front side of the heart from the back side of the heart. And we'll see that a little bit more when we get closer to the dissection. But the front side of the heart has this vessel that runs kind of at a perpendicular angle or almost on an angle down through the heart, whereas the back side of the heart only has a vessel that runs across the top. Right. So the front has this one that runs up and down. The back has one that runs essentially left to right. Okay. I'm going to take out the anterior ventricular artery. We don't really need to kind of remember that as well. But the last thing we need to know is this little point, which is the apex, which you learned in the last lecture is actually pointing towards the left hip. Okay, so those are your big things there. I'm gonna All right, so now this essentially is the same picture. We just now have done a little bit of a cross section so we can actually see the inside of the heart. We're going to actually give this to you in a little bit of a diagram tomorrow on Tuesday, or sorry, Wednesday, but I want to go through this a little bit with you guys again so that we make sure we have all the labels for it. So I'm going to open it up here in Cami so we can add some text boxes and kind of walk down through this and kind of label them. So a lot of those features that we saw on the outside of the heart are already here. So if we add a text box up here, would help if I had my text box ready to go. All right, so this little label up here at the top is going to be our superior All right, so that's our superior vena cava. That's the vessel draining blood from the upper portion of the body back into the right atrium. All right, next down in line here, this would be our right pulmonary artery. All right, so that's leaving the heart and going towards the lungs. Interesting side note is the pulmonary arteries are the only arteries that contain deoxygenated blood. Most other arteries, specifically your aorta and then anything from there on out, contains oxygenated blood, but your pulmonary arteries do not. All right. Next in line here is going to be our right atrium. All right. I'm going to do a little bit of abbreviating, so I hope that's okay for everybody. Okay, so that's our right atrium, our upper chamber of the heart over here on the right side. We usually talk about in terms of the heart. The atriums are on the top, so we always think atriums are A's, all right? So they point up, and then the ventricles are V's. They point down, so those are on the bottom half of the heart. So just kind of remember the difference between those. So these are always atriums, all right? These are always ventricles. Okay. All right, moving down a little bit further then. So these vessels right here are coming back from the lungs. So these are going to be your right pulmonary veins. All right, I'm just going to use V for veins there. This little structure right here is actually where the coronary veins dump blood back into the heart. So this is actually a little portion called the fossa ovalis. Right? But those are coming back from the coronary veins. All right. Next in line is the first valve that we actually have in the heart. So this is actually referred to as our tricuspid. Right. So that's the valve that actually separates the right atrium from the right ventricle. Okay. Looking forward up here for you. So that's our tricuspid. The way that I always remember this is tricuspid has an R in it. All right. We're going to learn about a bicuspid valve here in a second. But tricuspid has an R, so it's always on the right side between the right atrium and right ventricle. Okay. Moving down here, this is going to be, I know it's kind of hard to tell where these guys are pointing, but this one is actually pointing to the right atrium, or sorry, right ventricle. All right. And then this is pointing specifically to the little strings that connect the valves to the heart itself to kind of keep them from blowing backwards. All right. So these guys are referred to as the chordae tendineae. All right. They're often referred to simply as the heartstrings. So if you ever heard the term pulling on someone's heartstrings, these are what they're actually referring to. And then lastly is the large blue vessel that's actually dumping blood back into the atrium up at the top. So this is our inferior. That's our inferior vena cava. So that's everything that's going to be over here on the right side of the heart. Over on the left side, all right, our first thing is this large red vessel, which is actually coming out of the left ventricle. So this is the aorta. Okay. Next in line here is the other half of our pulmonary artery. So this is the left. That's our left pulmonary artery. That's going to the left lung. Okay. Next in line is going to be pointing to the chamber at the top of the heart. So this is the left atrium. Next in line down here is the counterpart to the pulmonary veins on the other side. So these are our left pulmonary veins. Okay. I could spell today. So that's left pulmonary veins. They're bringing blood back from the heart, from the lungs to the heart. All right. Next in line here is another valve that we actually have. So this separates the right ventricle from the pulmonary trunk. So this is the right. Sorry. So this is actually our pulmonary semilunar valve. So we actually have two semilunar valves, and this is our pulmonary because it's separating the ventricle from the pulmonary trunk. Okay. Right? And we a lot of times abbreviate semilunar valve as SLV. Okay. Next in line is going to be another valve. So this is the one on the left side of the heart. This is actually the stronger of all the valves in the heart because it has to take the most pressure. All right. So this is our bicuspid, which is often referred to as our mitral valve because it is similar. As people say that it looks like a miter's hat. All right. So that's the mitral valve, but specifically the bicuspid. Again, the way that I tell them apart, tricuspid, we've got an R in it. Bicuspid has no R. So tricuspid belongs on the right. Bicuspid belongs on the left. All right. And then this next valve is another one of our semilunar valves. So this separates the aorta from the left ventricle. So this is our aortic semilunar valve. Okay. Next one in line here is actually pointing to the chamber in the bottom of the heart. Again, I know it's kind of hard to tell, but this would be our left ventricle. Next one down here is pointing to this strip that runs down the center of the heart, which actually divides the heart into right and left sides. So this is our septum. I think there's a specific name for it. Let me give it to you here. I'm looking for it in our word bank. Intraventricular septum. I a lot of times just refer to it as septum, right? Which is fine to do. Okay. Next one is pointing to a layer of the heart. So this is pointing to the middle layer. So this is our myocardium. All right. And the last portion is pointing to the outside or kind of the apex of the heart. Or you could also say that's even pointing to kind of the outer layer, but we're going to refer to this as the apex. Okay, so make sure you take a look at those. Make sure you kind of have those in line. We're going to give this worksheet to you so you can kind of go back down through. And to be honest with you, our quiz is going to look very similar to this. So just make sure you've got your different labels and you can kind of put everything in the right portion for this section. Okay. All right, I'm going to move on just a little bit then. So we're going to take a little bit of a look. I'm going to post this song so you guys can kind of see it. It kind of talks a little bit of kind of the pathway that blood takes in the body, but it does help you a little bit. I posted a couple different things as well that kind of hopefully will help you guys out with those. So we should be able to kind of see those, okay? So this next section is talking a little bit about blood circulation. And you notice that there are two systems. There's the pulmonary circuit and the systemic circuit. The pulmonary circuit is over here. It's referred to, or kind of in general, it is put with the right side of the heart, okay? So that is our pulmonary circuit. The systemic circuit normally is referred to or often given to the left side of the heart because the right side is simply pumping blood to the lungs. Right side is pumping blood to the lungs. The left side is pumping blood to the body. There are a set of capillary beds that join the two systems. So this is all, the red is showing all oxygenated blood. All right, and the blue is showing all deoxygenated blood. So again, you can see this is the pulmonary vein coming back. That's oxygenated. Again, the only vein that's oxygenated. And then these are the pulmonary arteries leaving the heart, and those are deoxygenated. Okay. This is the same kind of thing we're taking a little bit of a look at. And I'll try to go through and fill that out for you guys. All right, so sorry, I clicked on that. So chambers of the heart, we have right and left sides act as kind of separate pumps, like I was talking about. Right side is involved with the pulmonary circuit. Left side involved in the systemic circuit, so going to the body. There are four basic chambers, right? We kind of already learned those. So we have atrias; those are at the top. Again, A is pointing up. Right? They're receiving chambers. So the right is receiving blood from the body, the left is receiving blood from the lungs. And then the ventricles are the lower chambers, again, V pointing down, and those are our discharge chambers. So the right is discharging to the lungs, the left is discharging to the body. All right, we need to kind of remember those basic structures. All right, circulation wise, we kind of need to remember the pathway of this, how this blood makes its way through the body. So a lot of times for the assessment or kind of the quiz, we're going to start in one part and you just have to remember where it goes. The thing that helps me and the thing that I always tell students is try to remember where your valves are. All right. So your bicuspid or cuspid valves are between the ventricles and atriums. The semilunar valves are always between the ventricles and a artery. Okay, so you have to remember where those are, and that'll kind of help you put these in place. So if we start here in the right atrium, all right, blood will flow from the right atrium to the right ventricle, passing through the tricuspid valve. So the tricuspid goes through there to the right ventricle. Sorry, yeah, and then from the right ventricle, we will go up through the pulmonary semilunar valve into the pulmonary artery. All right, that will then flow to the lungs, be exchanged to the pulmonary capillaries, and then brought back to the heart through the pulmonary veins. Again, pulmonary veins only oxygenated ones, pulmonary arteries the only deoxygenated ones. Once the blood gets there, it's now in the top of the left atrium. It then has to pass through another cuspid valve. In this case, it is the bicuspid valve. So we're bringing blood back through here. That will get us into the left ventricle. From the left ventricle, we are going to go through a semilunar valve. So this is the aortic semilunar valve, right? And that's going up through into the aorta. That is going to go to the systemic arteries. Systemic arteries will get us to the systemic capillaries, and then we will go to the systemic um, vessels, all right, so systemic veins, and then those veins will then branch off into either the superior vena cava or inferior vena cava, and then bring us back to the heart. Again, remember where your valves are, and that'll kind of put things in place. And also remember that the right side of the heart is going to the lungs. So if you remember vena cava to the right side to the pulmonary arteries, and then the left side is going to the body. So pulmonary veins to the left side, and then aorta to the systemic system. Okay. And we'll just kind of keep working through that. We'll do it a couple times. So with the valves, valves open as blood is pumped through them. All right. So so especially in the heart, if I kind of go back here, and this kind of shows you that basic process, but when blood goes into the atrium, it's going to open that bicuspid valve. All right. When the atrium contracts, all right, it's going to then force blood down through there. And for the most part, because of gravity, blood just flows through there anyway. All right, when this chamber contracts, though, it's going to close this valve because the valve goes the opposite direction. All right, it's sort of similar to the one that you would see like in your sump pump in your house. You might hear that make a big bang when it shuts off, and that's the idea, is that water's falling against that valve, closing it, but it's going the opposite direction. When the ventricles contract, the semilunar valves will open. All right. So when atriums contract, the cuspid valves open. When the ventricles contract, the semilunar valves open. And that's what kind of prevents that backflow. Those little chordae tendineae, those little heartstrings, are actually there to kind of control that process. And then there's actually a set of muscles called papillary muscles that attach to those valves that further anchor those in place and try to hold those. Usually when somebody has an issue with a valve, they have either an issue with the chordae tendineae, or they have an issue with the detachment between the chordae tendineae and the muscles themselves. Okay. All right. So the valves actually only allow blood flow in one direction because of their shape. Okay. We've got four valves. We got atrioventricular valves. All right. So those are between the ventricles. Those are the cuspid valves. Okay, so the bicuspid is on the left. Again, it's the stronger the valves, we get a much stronger contraction. Tricuspid is on the right. Again, we have the R that puts it on the right. And then our semilunar valves, or SLV valves, those are between the ventricles and the arteries. All right, so again, we got our pulmonary semilunar valve on the right. That's this one here. And our aortic semilunar valve on the left. That's this little one kind of hidden behind the pulmonary trunk right there. All right. This just shows you that circulation again, kind of going through that. This walks you through that basic circulation and shows when those valves are closing and when they're opening. So when the atriums contract, both cuspid valves or both atrioventricular valves are open. All right. When the ventricles contract, they are now closed, and then the semilunar valves are open. All right. The semilunar valves are closed when the heart is actually in between beats. All right, so we usually hear a heartbeat of like lub dub, lub dub. So lub would be the opening of these. So would be the closing, actually the closing of these ventricles, because when the atriums contract, they're forcing blood down. We're going to get a backflow of blood. So that's the SLV valves closing. The dub, which is usually much stronger, is then these valves closing here. Okay. So heart associated with the greater vessels. So again, these are the big ones we just kind of talked about. So aorta is leaving the left ventricle. Pulmonary arteries are leaving the right ventricle because they're headed to the lungs. Vena cava is going back into the atrium, and then our pulmonary veins are going back into the left ventricle. Again, the big thing here are these two guys here. So the pulmonary vein and the pulmonary arteries. Most arteries carry oxygenated blood, but the pulmonary arteries do not. Most veins can carry deoxygenated blood, but the pulmonary veins do not. Okay. Just another kind of picture of that circulation. And so I can't stress how much you need to kind of take a look at that. And then this is another just picture of the all over circulation. Again, I'll kind of go through this basic thing, labeling it with you to hopefully kind of help you guys out. Okay.